Hi, my name is Matt. I'm going to be your nurse today. How are you?
Good, how are you doing?
Good. So today I just wanted to talk to you about your newly prescribed medication, Diltiazem. You probably know it as Diltiazem. So this medication is used to lower your hypertension and your blood pressure. Hypertension is just a high blood pressure. Originally, you were prescribed a diuretic to treat your high blood pressure, but we're not seeing the results that we want to see with you taking the medication. So we're placing you on, the doctor's placed you on Diltiazem. So I just wanted to give you this education sheet just so we could talk through if you have any questions about the medication or its effects or anything like that. So yeah.
Okay, that's great.
Okay. So I have this. This is just that's all the
thank
information
you.
about the drug.
This is great. I can take this home?
Yeah.
Oh, this is great.
Yeah,
I
that's
have kids
great.
and I usually forget this, so now I can look back at this and I forget what we talk about.
Okay, cool. Okay, so this is the educational paper.
Okay.
We're just gonna run through it. It's very understandable. It's written in a way that you would understand. So we're just gonna hit on what I think is most important throughout this entire paper, and then it'd be beneficial to you when you go home, like read through it again, just to get a better understanding of everything. So Diltiazem, it's gonna help lower your blood pressure and hypertension, like we said. What it does is it blocks, like in medical terms, it blocks the calcium ions crossing the membranes of cardiac arterial muscles. So what it's going to do is relax your heart. So that chronic heart and chest pain that you're feeling will most likely go away. We hope, because it decreases the overall workload of the heart. As we move down, it's important to note that we want to monitor your heart rate and rhythm. So whenever you go to your doctor, like make sure we want to see those results and all that. And we want to make sure you tell your healthcare provider about any medications that you're taking before you start Diltiazem.
Okay.
Also, it's really important to note if you have any allergies, because this drug could have interactions with other drugs that you're taking. And all those drugs are listed in here. So if you are taking any of these drugs, it would be smart to consult with your doctor who's prescribing the medication. So there's three things when taking this drug. So you don't want to miss the dosages. You want to take them at the same time, like start a schedule and take it at the same time every day. So you're like consistent with it. And the last thing is you don't want to crush or chew the medication. So do you have trouble swallowing pills?
I don't like to take pills. I usually like crush them and put them in my meals because I don't like to eat them. I've never been good at swallowing pills since I was little.
Okay, so what you could do is, you could take it with a lot of water. That would maybe help, or even putting it in like applesauce or like pudding. But just make sure you don't chew it. We just kind of want to like mask that you're eating a pill with the pudding. But yeah, make sure
this medication the same time each day. I usually forget to take my medication. I'll just take it one time a day because I'm really busy with my kids and going to work and picking them up and dropping them off at school. So
yeah, definitely. I totally understand your situation. So what a lot of patients that I've talked to and have like the same issue as you, because a lot of people do have problems being consistent with taking medication, is to set an alarm on your phone. Everyone's got you have an iPhone?
Yeah.
So what you can do is go into your calendar, go into your notes, go into your alarm, whatever, and then just type in, take medication, and when you always have your phone on you, so that'll prompt you to take your medication if that helps.
Okay.
So a quick thing, little strange, you might find it strange, but you want to avoid taking this medication with grapefruit juice. Do you like grapefruit juice?
No.
Okay, that's great because you're not supposed to take it with this. To get into some side effects, they're right here, they're listed. Headache, dizziness, flushed skin, weakness, fatigue, nausea, constipation, abdominal discomfort. So if you experience any of them, maybe call your doctor.
Okay.
And then, contact your physician if you experience any of these side effects. Like I said earlier, you want to make sure that all the other drugs that you are taking aren't going to interact like in a bad way with Diltiazem. So definitely check with your doctor. I know for a fact that the benzodiazepines, they have they're like contraindicated when taking Diltiazem. So definitely check with your doctor about the drugs that you're taking right now.
Okay.
Lastly, you want to store this medication in a dry place. I want to imagine that you would store it in a wet place, but
In the bathroom.
yeah. So just maybe like in a cabinet in the kitchen or something, somewhere dry. And then call your healthcare provider if symptoms do not improve or get worse.
Okay.
And then, like I said, that was just a brief overview of everything that I thought was most important to tell you, but it's very understandable, so you can go through it, read it when you get home, and you'll have a really good understanding of the medication. You'll feel a lot more comfortable.
Okay, thank you.
Okay, so just to close out, we're going to talk about your medication administration. So we want you to be taking this drug 3 times a day, every 8 hours.
Okay.
And you're going to be taking it orally, so in your mouth.
Okay.
So that's really all. If do you have any other questions?
No, not really. I think I got it all.
Well,
I got this paper.
I hope I provided you with the information that you needed, that like was helpful to you.
Mm-hmm.
Just to go through a couple things, just so I know that you understand. Mm-hmm. So what shouldn't you take this medication with? Like what type
Grapefruit juice.
Okay, great. So what should you tell your doctor?
Any of the signs and symptoms that I have on the paper, allergies, any meds I take.
Perfect. And when do you take this medication?
3 times a day, every 8 hours.
Awesome. So it looks like you have a pretty good understanding of everything. That's great. So just please report any of these signs and symptoms. Also, it's important to report if you're planning to become pregnant to your doctor, as this medication might have maybe some side effects in pregnancy.
Okay.
So that's all. So I hope this was helpful, and have a nice day. Okay.
Thank you.
All right.